Hello guys, welcome and welcome back to my YouTube channel. In case you're new here, karibu sana. In case you're returning subscriber, welcome back. This is the channel whereby you get to learn different ways of livestock keeping and farming. So guys, as you can see today, behind me you can see cows. If you remember very well, in the previous video, if you watch my videos oftenly, there is a video I did about dairy farming, and I felt the need to bring in a doctor who is going to explain more on the livestock diseases. So guys, today is the day. So before we go very fast, before I introduce my guest of the day, according to my analysts, I've noticed that 90% of people watch my content have not subscribed, guys. So guys, take your time and click the subscribe button. It is that button yenye imeandikwa in black, imesakuliwa hivyo. Maybe inapiga kelele and maybe some of you don't know how to subscribe. You just click, you tap like this, and just like that inakuandikia hapo subscribed. So guys, without further ado, I'm going to introduce the doctor who is going to take me through the livestock diseases and explain to us what we need to take care of our cattle. So guys, karibu sana daktari.
Thank you.
Kindly introduce yourself to my viewers.
Okay. Hello guys, my name is Dr. Kiogora Mugambi. I'm a vet surgeon practicing within Meru County and the environs. I operate a clinic by the name Tornado Vet Clinic with a number of other colleagues, vet surgeons.
So daktari, I told my viewers that I will bring them a doctor who is going to explain to them. Now you are here. I want you to explain to us some common livestock diseases and tell my viewers who are farmers or who want to do farming what they need to do as a way of taking care of their livestock. So where do we start? Do we start with the big animals or we start with the small ones?
Okay, maybe we can start with the calves because calves are the cows of tomorrow, so that we learn very few things that affect farmers and they affect the dairy calves.
Okay.
Yeah.
So we go to the calves?
Yes.
Okay.
Okay, here we come to calves. Most of our dairy cows quality comes from whatever calves we have, and we should remember that today's calves are tomorrow's cows. So if you have a poor quality or your calf dies, then it means you never have a good or any cow. So some of the things that kill or maybe makes one not have an adult cow, it's maybe if you have a retarded calf or if the calf dies. So a number of things might kill a calf, especially from the date or the time of birth. Some of them, it's like when we go to human beings, we ensure that every time a calf is born, you are supposed to ensure that the calf is breathing. So you are supposed to make sure once the calf is born, you try to remove all the fluids from the nostrils so that the calf starts breathing. Sometimes we might get he or she, the calf, has swallowed some amniotic fluids. So the best thing, maybe we can, sometimes we pour water or we have some dust on the nostrils so that they sneeze, so that to remove the fluids. Other times we try to hold the hind limbs upside down and swing so that to ensure whichever fluids are in the lungs get out. Other times, if you see the calf is still not breathing, you try to resuscitate like how you do with human beings. That's pressing on the chest. Other things that make a calf, other problems that we see in the calf, it's all related to housing, and we are supposed to ensure we have a calf pen. A typical calf pen is supposed to be like this, raised, have a wooden or something on the floor with gaps. The gaps are not supposed to allow the calf limbs get through it so that we don't get fractures. We are supposed to have them having a grid to grasp the limb in case the calf slips. We don't want to have a fractured calves. The calves with leg fractures. The gaps on the floor, they allow whichever waste, either the feces or the urine, to drop down. We don't want to have a wet calf pen. The problem with having a wet calf pen, you see, like to human beings, children keeps taking anything to their mouth. The same happens to calves, so they will keep licking the walls. If it's dirty, we have a problem called coccidiosis, and this problem makes the calf have diarrhea, and many times you see blood diarrhea. We are supposed to surround the calf pen where you are not allowing a lot of weed or like a lot of wind to get to the calf, so that we prevent pneumonia. We are also supposed to have a roof. Some calves with the whitish patches, they might be affected by the direct UV light, so we don't allow calves to have direct sunlight. It might affect their skin. So we have pneumonia, diarrhea, lack of breathing, photosensitivity. Those are the common problems that affect calves.
Okay, baby doctor, which variety is this and which one is that one, the black and white?
Okay, we have different breeds here. This one is a Fleckville, and the other one is a Frisian. So this one is more of like a dual purpose. In terms of milk production, it maintains the production at the same level from the time of calving almost to drying, and then by any chance maybe you need to slaughter, they put more muscles as compared to the Frisian cows that don't put more of their energy on putting weight or putting muscles.
Okay.
Yeah.
Okay. So now are we done with the calves?
Yes, I think we are done with the calves. Other things is just a nutrition part. The nutrition, as you can see, they are having water. We have different containers. We are supposed to check the time you're introducing all these things. We are supposed to have clean water always to the calves. The second thing, it's a check on how you feed on the milk. It all starts from the very first day. We are supposed to ensure that your calf gets enough colostrum within the 6 to 12 hours, which mostly we get 6 liters within that time, so that you allow a lot of antibodies to get into the body system to allow the calf immunity to develop. Other things that we feed the calf is pellets. Those pellets are for nutritional purposes and helps in development of the rumen of the calf.
Okay.
Yes, I think those are the brief things about the calf. Yes.
Okay, that is so enlightening, guys. I hope you guys are taking notes there, because some of you neglect the calves. So I hope you are taking notes down there. So as you continue, guys, give me the likes, the comments, and also remember to tap the screen and subscribe. So Dr. Ari, what about the dehorning issue? Why do we dehorn the calves?
Okay, when we come to dehorning to the calves, they don't have horns, so we call them bands. So we disband.
You disband?
Yes, we are supposed to ensure they are. Nowadays we have in the pharmaceutical industries, we got like pastes that helps in disbanding. It's just a matter of application. All you need to do is contact your vet. Will help you on that. You have some paste that you apply on the very first week or the very first few days of life, or few months, especially in between 2 and 3 months. Others, most of the pastes need to be done earlier. So it's for cosmetic purposes. And when Frisian cows are not as the same as our indigenous cows, they are more aggressive, they are more prone to fighting. So we don't want to have adults that are fighting, and this fighting maybe we might cause injuries, might cause abortion. So we want to have cows or calves with no horns.
Okay.
That's the main purpose of disbanding or dehorning.
Okay. So there is a farm I visited and I found out that it was a Frisian calf. I found out that the color is almost turning brown instead of being black. Others have the fur that is inaka imeamka, fur is racing up instead of it being smooth. These ones are very smooth. What happens mpaka hiyo fur inaanza kusimama hivyo? What is the issue?
Okay, most of the things that might cause a cow or a calf to have it's called a rough hair coat.
It's called rough hair coat.
Rough hair coat. You are supposed to have a smooth hair coat. It's it's you see like you are combing the fur of a cow or you are cleaning and you are painting the color of that cow. Most of the times you might have worms. They might cause a calf to or cow to have raised hair. The change of coloration mostly goes to the minerals. Other times it's worms. Worms will make calves hair rise, and other times when a cow is sick, that's one of the signs that we might see.
So deworming is very important.
Yes, deworming, especially to calves, you start from 3 months of age and you repeat. You do this routinely every 3 months of life, and this goes to all cows also.
Okay.
Whether milking or not, whether pregnant or not, you are supposed to deworm after every 3 months.
Okay.
Yes.
Okay. So now we are done with the calves. We go to the other animals.
Yes.
Okay. So daktari, now we are in the other lot for the. Leo utanipea terms. Today you're going to give me the medical terms. Niache kuziita ng'ombe kubwa, ng'ombe ndogo.
Yes.
I have to learn.
These are milking cows.
Okay.
Milking cows.
Okay, tell us about them.
Okay. To milking cows, there are small things that for every farmer you need to have cows that are producing, and we want individual cow to have good or high amount of production, and there are a number of things that might cause a cow not to give you that milk that you need. One of them, these cows need they need to be comfortable in the very first place. One of the things that we want with them, they are supposed to every time have quality fodder, and their feeding troughs, they are supposed to have fins, or they are supposed to have something each and every time, like every time they need to have it. Why? This is because when we have zero grazed cows, they have an habit of taking fins for like 1 to 2 hours and then going to rest for 1 to 2 hours. In fact, an adult cow or any cow will need to have a rest of around 10 to 14 hours a day. Then it means suppose we have 14 hours in a day, the remaining 10 will be used on feeding and milking. So it means we need to ensure that cows don't remain standing waiting for feed for you to bring fins in the trough. They are supposed to have it all the time. The same thing as to water troughs, it's supposed to have clean water always, because a lot of milk comes from water. The biggest percentage it's water, so we need to give cows water so that they are able to produce a good amount of milk. So when I need to connect to that, you might need to come closer. So cows, as we have said, they need a comfortable resting stores. These are called stores. They are supposed to have a good length and the width. We don't need the narrower stores, because cows will not fit there. We don't need the shorter stores, because cows will not again fit there. A typical cow store is supposed to have 3 qualities. One, supposed to be clean, dry, and soft. So, for example, when it comes to our stores, do you see them clean?
Yes.
Are they dry?
Yes.
Is it soft?
Yeah.
So to make it soft, so it's either you can use sand, you can use tree leaves, you can, to those who can afford, they can have mattresses. So how do you test if now we will test with our eyes if the stores are spacious enough. We can see if the place is dry, but we have a test that we can that can help us know if the stores are dry and they are soft. We call it knee test. This is what to do for you to do the knee test. You come, do this, at that point you drop your knees, because this is exactly how cows sleep or lie down. They just drop themselves. So you drop yourself like that. If you hurt your knees, then you know the place is hard. Like for example, if it's on this concrete floor, I could not have attempted to drop my knees.
Yeah, because it's very hard.
It's because it's very hard. So like I was never hurt. This place is soft. So I will stay here for like 15 seconds. I think those are 15 seconds. By any chance I get up and I see wetness on my knees, then I'll know this place is wet. Why do we want the place to be dry and clean? We have a problem that is brought by wetness. Germs growing on wet areas. So wetness, where will we get this wetness first of all from? It's either from the rain or the cow themselves wetting the place. So on this, we will have to ensure that we have a roofing. We need to control the movement of cows so that this place is not wet. The wetness will bring along mastitis. Mastitis is the biggest problem we have. And where do we get mastitis from? It's either from the stores or people bringing it themselves with the hand. Hii ni ugonjwa ya uchafu. Germs getting through the teeth canal or the teeth opening. So we are supposed to ensure this place is dry. Every time we are going to milk, we are supposed to ensure we clean our hands with soap and water. And this is supposed to be done when milking cow 1. And you repeat the process, moving to cow 2, and the process continues. Now, another thing that may bring mastitis is the clothes that we use to dry or to wash the udder. Every cow is supposed to have like 2 clothes. When we have these towels, once you are done with milking, you are supposed to clean them with soap, hot water, and then dry them so that we will have something to use. We need dry towels for each and every cow. So we need 2 for every cow. Something else, for these cows, for them not to produce, we have diseases that are preventable. Around our place, we have foot and mouth disease, lumpy skin disease, we have anthrax, and we have another disease that is called black leg or black water. All these diseases most of them are endemic within our place. Why? What do I mean by endemic? We are with the diseases around. We see it more often. Why do we have these diseases? We have our small pieces of land, so we depend on bringing in or importing or maybe getting fodder from other places. Some places maybe it's from the bush, or maybe not even the bush, or the farms that have bigger shambas. So when we bring the fodder, if by any chance there is a disease there, then we carry the disease to our place. That's why we have those kind of diseases. And for them, if you would like your farm to not to get these diseases, which are preventable, ensure that you vaccinate your cows. I said we have 4 main diseases around. So after every 6 to 12 months, vaccinate against these diseases. Something else that we should note, for all the diseases, you need to have your records, right? So that you can get a reference to know where or when you are supposed to vaccinate your cows. For cows, as we know to human beings, we also need maternity in a farm. In a maternity, what you need to provide is you are supposed to have a spacious area. Like for example, this one, you can see it's not like the size of a store. Then it's supposed to be dry and clean also. Why? We don't need a cow to have struggles when calving. Some of the cows will start calving and they will be in the stores, and the moment they are pushing their babies, they press it on walls. So again, we get calf dying. We don't want to have dead calves because we need them. We want the place to be dry for the purposes when a cow is almost calving. It starts the milk start leaking from the teeth, or the teeth open. So we don't need them to have a wet place, as we mentioned earlier. So we need a clean place. Again, when calves are born, we are supposed to take care of the umbilicus, the umbilical cord. We don't want it to be infected. So we have to ensure that we have a clean calving or maternity area.
There is this issue with most of the farmers. They complain that the cow has eaten the placenta, now it is not getting out the milk. So what is this issue with the placenta and the cow eating the placenta?
Okay, in most of the cases, this issue of placenta have a lot of debates, but you need to know, why is the cow eating placenta? Is it that it is this it's very tasty, or they miss the placenta? Remember, the cows were in the wilderness. They were in the just taking care of themselves, and they were with other animals, predators around. So the instinct of taking or eating their placenta is to withdraw evidence that they have babies. You see, animals are good at detecting smells, so they don't want other animals to detect there is a smell of meat. So they are just withdrawing evidence that they have a baby. They don't want other animals like hyena or cheetah, something else, to come and eat their baby. So that's the reason as to why they eat their placenta. But in case now a placenta is eaten by a cow, am I supposed to be worried? I don't think I should be worrying so much, because this placenta, the problem with the placenta, it's made up of very strong blood vessels. It's not digestible.
Yeah.
So when you come to cows, are not meant to eat meat. So they are supposed to eat grass. So when they come to eat this placenta, which is stronger than the normal meat tissues, so they feel like they are full because it's not digested. But so that's why they will not take feeds for some few days. But after some, like within 7 to 10 days, the placenta will have been digested and get out. So the cow will continue with normal
Milk
production, and not a mass of cows stop feeding. So in most of the cases, it's a myth that the cows, once they take their placenta, they will not produce milk.
Oh, so it is just a myth.
It's just a myth.
But
other problems will
be
be
careful so that they won't eat.
Yes, we need to be careful also again.
Okay.
But when it comes to the placenta, you need to know the time that you are supposed to know that maybe this cow has removed, or maybe it has retained the placenta. it's within 12 to 24 hours. You are supposed to take care of your cow within those hours. If the cow goes beyond 24 hours without removing the placenta, then you know that placenta is retained. So the simple thing, like a simple farmer is supposed to do, you are not supposed to sleep outside taking care of animals, not to eat the placenta, or taking care of dogs, not to chew the vulva of the cow. So what we are supposed to do is try, after 24 hours, try to pull as much as possible the portion of the placenta that is out, then just cut it and clean the vulva. The dogs will not eat or not chew the vulva.
Okay.
Simply because they are not seeing any evidence. So then you can consult your vet to come and do the necessary to your cow.
What makes them retain the placenta?
There are a number of things that makes a cow retain a placenta. We have 4 main things. First of all, it's minerals. We have a mineral by the name selenium. This is found mostly in the dry cow minerals. So selenium helps in ripening the attachment point of the placenta with the uterus. So minerals will play a role. If a cow gives birth earlier than expected, there is high probability of them retaining placenta, simply because the attachment point again will not have ripened to attach. It's like the same idea of maybe having mangoes and the ripening. The attachment point, when it ripens completely, that's when it detaches from the point of attachment. Something else is a difficulty calving. The cows that have difficulty calving, it's known as dystocia. You help your cow a lot, many hours to pull out the calf. They have incidences. The fourth one is twinning. Twins will come earlier than expected. This again, I had explained the process, the problem maybe of calving earlier than expected.
Okay.
So other problems maybe we see with cows at late gestation. We have problems with the cows maybe getting pierced. Unasikia watu wakisema imedungwa na misumari or wires. This happens during late pregnancies and during calving. But we have a problem. We have a solution for that. We introduce rumen magnets. We don't wait for our cows to be pierced, to call a surgeon to come and operate your cows. We have a solution of having your cows with rumen magnet.
Okay, I've had so many farmers debate about the rumen magnets. Is it expensive to install?
No, it's not expensive, and you do it once. So it's not expensive. Most of the times it will all depend with maybe the vet where is they coming from. But itself, you debate, you just negotiate with your vet. People, the vets are good people. You just negotiate your way and they do it well. Many farmers have done it, so it means it's not expensive.
And Dr. I understand you happen to do those services in your clinic. So how can they get you in case they need you to install the rumen magnet or also just treat their animals? How can they get you?
Okay, they can get me just through a phone call. I'm just a phone call away. Maybe, can I give my contact?
Yes, you can give your contact.
Yes, my contact is 07 02 02 18 89.
Okay. So they can get you for any kind of services?
For any kind of consultation, any kind of treatment, any kind of surgery, or any form of advice on dairy farming and other vet-related issues.
Yeah, even the cats, the dogs.
Even the cats, the dogs, yes. Yeah. We board in our clinic. We have a boarding facility for pets, dogs. If you don't want your cats or dogs to have babies, we can come and do surgeries, remove their uterus. You have your nice dog there. We do vaccination. We do grooming. We wash your dogs. We just deflea. We ensure that your pet doesn't have parasites. So we offer all those services. A
Okay.
phone call away.
Remind them your clinic name for those who might be near and where they are located. Do you
Yes.
have like branches or you have one clinic?
We have only one clinic in Meru by the name Tornado Vet Clinic. It has this kind of label. You can see it. We have a number of vet surgeons there. We have 4 staff in the clinic. We other vet surgeons, so you can get all of us if you wish.
Yeah, guys, I will link the number of doctor there below. You can go and visit Tornado Vet Clinic in case you are around Meru, or you can just call the doctor and everything will be done to you. Whatever you need, any kind of vet, any kind of animal, even if it is a lion, the doctor will treat. He's a qualified vet surgeon. So he treats everything, Simba, elephant, everything, even the animals, all the kind of animals. See, you really that
Yes, that's
yeah.
true.
The vets specialize in all kinds of animals. So guys, that has been it for today. I've really enjoyed. Thank you so much, Daktari.
Thank you. Karibu, karibu.
I've gained so much knowledge today. You can see the viewers can understand today. I'm very quiet because these medicine terminologies and I'm not conversant with most of them. So today I've learned a lot, and thank you so much for engaging my viewers. I think they will learn from you. Today they have learned a lot. Comment down below, guys. Whatever you've not understood, Dr. Remy will reply the comment section together with me. So anything you feel like asking, whatever we have not mentioned, you are free to ask questions and we shall get back to you. So that has been it for today. Don't forget to like the video, comment down below, and subscribe to my YouTube channel. So guys, till the next video, bye. See you in the next one.
Bye.